Okay, so today we're taking a deep dive into scoliosis.
Right.
And we're going to be looking at a pretty cool source.
Yeah.
An excerpt from a medical textbook.
Oh, wow.
So this is definitely geared towards, like, healthcare professionals.
Okay.
But we're going to try to break it down.
Right.
And make it understandable and insightful for literally anyone, whether, you have scoliosis personally or care for someone who does or are just,
Interesting.
curious about it.
Cool.
So yeah,
This will be good.
our goal is to give you a really solid understanding of, what scoliosis is, what causes it, how it's detected,
Yep.
and the different ways that it can be treated.
Sounds good.
So I guess, most people, when they think of scoliosis,
Right.
they just picture like a curved spine.
Yeah, just a simple curve.
Yeah. But this excerpt goes way deeper than that. What exactly are we talking about here when we say scoliosis?
So scoliosis, like you said, it does involve a curved spine, but it's defined as a sideways curvature of the spine that's greater than 10 degrees.
10 degrees.
Yeah. And what makes it even more complex is that the vertebrae, they don't just bend.
Okay.
They actually twist.
Oh, wow.
So that twisting can lead to...
It's not just like a parenthesis.
No, not at all.
It's like
It's three-dimensional.
Yeah.
Yeah, and it can lead to a lot of things like uneven shoulders. One hip might appear higher than the other.
Wow.
And even the ribs might stick out more on one side.
So this is pretty serious stuff.
It can be, yeah.
Yeah.
And the textbook actually includes a really helpful visual of this.
Oh, interesting.
And it helps you to really understand, like, the three-dimensional nature of it.
Okay, so I'm looking at the visual right now.
Yeah.
And yeah, I mean, you can really see how...
It impacts the whole body.
Yeah, it's not just the spine. It's
Right, it affects everything.
the whole back, the ribs.
Exact.
It's pretty wild.
Yeah, it's important to remember that scoliosis can impact people in different ways.
Right.
Depending on the cause and the severity.
So I guess there are different types of scoliosis.
Yeah, so the source breaks it down into three main categories.
Okay.
The most common type, especially in adolescents, is idiopathic scoliosis.
Idiopathic scoliosis.
Yeah, and idiopathic basically means that doctors don't know the exact cause.
But they don't know what causes it?
Not exactly, no.
Interesting.
Yeah, and then there's neuromuscular scoliosis,
Okay.
which is linked to conditions that affect the nervous system or the muscles.
So like things like...
Yeah, things like cerebral palsy or muscular dystrophy.
Got it.
And then finally, there's congenital scoliosis,
Congenital.
which is present at birth.
Okay.
And it happens because of the way that the bones develop in the womb.
Oh, wow. So that's like a...
That's a developmental issue.
Yeah.
Yeah.
So, okay, so with the idiopathic type,
Right.
if they don't know what causes it,
Yeah.
how do they even begin to detect it?
Well, that's where early screening becomes super important.
Okay.
The textbook talks about a simple screening test where a child bends forward at the waist.
Okay.
And then you just observe their back.
Okay.
And you look for any asymmetry.
Oh, interesting.
Yeah, it's really a visual check.
I see.
They recommend doing the screening for girls between 10 and 12 years old.
10 and 12.
And for boys between 13 and 14.
Okay, so kind of right around when puberty hits.
Yeah, exactly.
Yeah, so catching it early,
Catching it early is key.
that can make a difference.
Yeah,
in
it
terms
can
of
make a
well,
huge difference.
Okay.
Yeah.
So let's say scoliosis is detected.
Right.
Then what?
So the course of treatment really depends on how severe the curve is.
Okay.
And that severity is measured in degrees.
Degrees.
So for curves between 25 and 45 degrees, bracing is often the recommended approach.
Bracing. So I imagine wearing a brace as a teenager,
Yeah,
that's a pretty big deal.
it is. It's a big deal.
Not just physically, but like...
Emotionally, socially.
Yeah.
Yeah, it can affect everything. The textbook actually highlights this really interesting case study
Oh, wow.
about a young athlete who had to adapt to wearing a brace
Oh,
while still trying to stay active in sports.
yeah.
So it talks about the importance of open communication between the patient, the family, and the healthcare provider
Right.
to address both the physical and the emotional challenges.
Makes sense.
Yeah.
So how effective are braces? Do they actually correct the curve?
So that's actually a really common misconception.
Okay.
Braces don't actually straighten the spine.
Oh,
Their main purpose is to prevent the curve from getting worse
I see.
as the child grows.
So it's kind of like putting a splint on a tree branch
Exactly.
to help it grow straight.
Yeah, that's a great analogy.
And I imagine, wearing a brace almost constantly until you're done growing.
That's a big commitment.
Yeah, it's got to be tough.
It is.
So the excerpt mentions that bone growth typically stops.
Yeah.
But 2 years after girls start their periods,
Right.
And when boys need to shave daily.
Yep. So it kind of puts it in a funny way.
Yeah.
But those are pretty universal markers.
I guess so, yeah.
Yeah. Yeah.
So what if the curve is more severe than 45 degrees?
So for cases like that, surgery might be necessary.
Surgery.
Yeah, the textbook goes into detail about different surgical techniques.
Okay.
Like spinal fusion.
Spinal fusion.
Which involves connecting vertebrae together to stabilize the spine.
Wow, okay.
And it really emphasizes the importance of pre- and post-operative care.
Oh, that makes sense.
Yeah, including specific exercises and techniques to manage pain and prevent complications.
So it's not just the surgery, it's like...
It's a whole process.
A whole journey.
Yeah, absolutely.
Okay, so it sounds like managing scoliosis, no matter how severe it is, it's a really involved process.
It is.
So what would you say is the key takeaway for our listeners today?
Well, I think the most important thing to remember is that each individual's journey with scoliosis is unique. Even though we focused on the medical aspects, there's a lot more to it than that.
Yeah.
And it's crucial to remember that there are resources available, support groups, communities, where people can connect and share their experiences.
Right.
Knowledge is empowering.
For sure.
And feeling connected can make a world of difference.
That's a great point.
Yeah.
So just a reminder.
Yes.
Everything we've discussed is for informational purposes only.
Absolutely.
If you have concerns about scoliosis, definitely talk to a healthcare professional for personalized advice and treatment.
That's important.
Thanks for joining us.
Thanks for having me.
On this deep dive.
It was fun.
Into scoliosis.
Yeah, scoliosis is fascinating.